Right, please go ahead, Dr. Herman.
Thank you, Chair Dexter and members of the committee. Do we have ability to share slides, or do you have that? Because I can't share quite yet through the platform. Oh, there we go.
Great.
Thank you. And you'll forgive my screen clutter for a moment. All right, thank you. So today we wanted to talk a little bit about our presentation on long COVID, go through the basics, spend a moment understanding the importance of the mental health aspects, review some real life examples with our patients, talk about what we're doing here at OHSU and how we support this community and moving forward in the future. So there's been a lot of discussion in the media about long COVID, but what is it? So essentially individuals that have experienced new and persistent symptoms 4 or more weeks after the initial COVID infection. This is known as chronic COVID. In the medical community, you may hear the term PASC, which stands for post-acute sequelae of the virus SARS-CoV-2. But patients, meanwhile, often refer to themselves as COVID long haulers. And so how many people are getting this? What do we know? And so from estimates from the CDC and others, which are now looking towards numbers about 1 in every 4 or 5 adults, when you factor in pediatrics and other unknown data, we think that it's about 10 to 30% of anyone who gets COVID is at risk for long COVID. So if you look at the numbers of COVID cases across the country and sort of extrapolate that down into Oregon, you can see that this puts us at risk for approximately 73,000 to 230,000 individuals that are projected to have long COVID. And I have the opportunity and the privilege of being co-chair of a national committee for all long COVID clinics. And there's a dashboard that's developed up here in the right corner that allows you to essentially click on any county in Oregon and get an idea for the estimated numbers of long COVID patients. And so while this is a smaller percentage of all patients with COVID, you can understand that just how impactful this is on the public health. And so do we have an idea who of that 10 to 30% is likely to get long COVID? And we don't have a perfect answer, but what we know is anyone who had COVID, anyone who has COVID is at risk for long COVID. It affects all ages, adults, children, everyone. And it also affects whether or not you've had a severe or mild case of COVID. In fact, most of the individuals we see in our clinic, in our program, actually had mild symptoms. So that affects every county and every social demographic. Not surprisingly, likely due to health equity issues, we see a larger preponderance of women between 35 and 70, those that have chronic conditions such as diabetes, but we know that minorities are disproportionately affected by COVID and anticipate that they will be at greater risk for long COVID. Good news is that vaccinations make a difference. For people that are vaccinated, there is a decreased risk of getting long COVID. And so as we try to understand this condition better, some of the proposed ideas about why people get long COVID include sort of a dysfunctional immune system, over inflammation, the virus may be hiding somewhere as kind of a reservoir, or maybe dysfunctional clotting. And so what are the characteristic symptoms? And quite frankly, this is broad and it affects almost every organ, every inch of the body can be affected. We have 3 here in green that are most commonly seen, but truthfully, this affects everything. And so we often hear about this extraordinary sense of fatigue that people experience, brain fog as they have difficulties navigating through their day, and the toll on emotional health that this has on people. They experience discomfort while they're trying to breathe. Inexplicably, their heart can start racing without provocation. Very few people have good night's sleeps. It's disrupted, it's shortened. You all are very familiar with people that have difficulty with their sense of smell and taste, but also many are plagued with persistent headaches and painful nerve abnormalities. And there's just too many that we can put on one page, but you kind of get the idea. So one of the most hallmark symptoms of long COVID is this idea of post-exertional malaise. And what this is an extraordinary, profound, and disabling sense of fatigue that occurs with just a minimal amount of exertion. either mental exertion or physical exertion. And so patients will have these cycles where they're starting to feel like they're having a good day and they just want to get back to being normal. And they do a few things that anyone would normally do, and then they will crash. But the strange thing is the crash isn't immediately after they exert themselves. It's often delayed 12 to 72 hours, much like you see in chronic fatigue syndrome. So this delayed onset of profound exhaustion can be triggered by the simplest of activities, such as doing a load of laundry, taking a shower, or even getting the mail. And it can be triggered by symptoms that are just cognitive activities, such as having to do too many forms or emotional stress that can be taking place at home. And we've heard a lot about brain fog, and what does that mean? And so there's a lot of complexity to how we think about how the human brain works and thinks. But some of the things we understand most about long COVID is patients are just struggling to find the right words every sentence, every paragraph, every time they're trying to communicate with their friends and loved ones. They can't retrieve the words. And they have difficulty problem solving, thinking their way through the day's events that need to be taken care of. And also that working memory, what they need to do their jobs and to take care of their families and prepare meals. All of this is impacted, much like we see with patients or athletes that have had post-concussion syndrome, very similar type of look and feel and presentation. And so are people getting better? What do we know about how people recover and what's their prognosis? And so we see these very unpredictable cycles of getting better and getting worse. Most patients with long COVID will have these cycles of getting better and getting worse, and they can be so demoralizing. And on top of that, the recovery timeline is variable. Some people, just like some people who get acute COVID, some have severe, some have mild. Some people that progress to long COVID, their recovery can be the course of weeks. Most, it's in the order of months. And there are a few now that are seeing over years, which they sometimes have now called themselves long haulers. And the challenge is we don't have a crystal ball to tell us who is going to be the one that gets better in months and who's going to be the one that persists. And we're struggling to try to get that information, but we just don't know. But what we do know is that avoiding that overexertion, doing too much, trying to get back to normal too quickly, it can be detrimental. And so the key to getting better is taking your time and pacing everyday activities so that you can ensure your posture, your position, your planning, all of that is thought through and you avoid post-exertional malaise. So you can imagine the enormous toll that this has on people's emotional health. And so for that, I'd like to turn it over to my colleague, Dr. Jordan Anderson.
Thank you, Dr. Herman. And thank you, Chair Dexter and committee members for the opportunity. So I'm going to talk about mental health symptoms and their significant impact on this population. One of the really important things that we've discovered with these folks that have struggled with these symptoms for so many months or years now is that they're developing severe mental health symptoms that are actually impeding their recovery and making their lives a lot more difficult than they used to be. The symptoms that we're seeing in particular are depression and anxiety, most commonly at a moderate degree of severity or severe, to the point where suicidal thoughts are actually pretty common. And for the most part, suicidal thoughts, suicidal intention are occurring in the first time for these individuals. They've never had suicidal thoughts or suicide attempts in the past. And I've had several patients for the first time in the last 2 years have actually attempted suicide one or more times. A lot of these individuals have had pre-existing mental health problems. However, typically the pre-existing mental health problems are mild. That being the case, they are commonly made much worse when they do experience long COVID. Some of the themes that I wanted to make sure we discussed that I've picked up on in the time that I've spent working with this population is that a lot of these folks experience a sense of isolation because they've been struggling with their support systems not necessarily understanding the experience that they're having. That could be spouses, family members, friends, and it can even be healthcare practitioners or other individuals that are taking care of them in the office. We find that the lack of education about long COVID, the lack of awareness about what it is, leads to these individuals feeling like they are alone, they're struggling by themselves. also there's a tremendous amount of grief. And what I mean by that is people are grieving the loss of their former lives, their former ability to do things independently, like work full time or work at all, or take care of their family, their children, tend to their relationship with their spouse, uh, pay the bills, pay for their mortgage. They're finding that they're completely unable or mostly unable in most cases to do most of these things consistently. And so there's just a tremendous sense of loss that they're experiencing. And when that sense of loss really amounts and is persistent, these themes of helplessness or hopelessness tends to really develop and build. And we find in the mental health world that helplessness and hopelessness are key features of someone who develops suicidal ideation. Next slide, please. I'd also like to highlight that there are several social themes that we've been picking up on in the time listening to the patient's struggles, and they definitely tie into the mental health struggles as well. I had talked about already the lack of awareness in the community and in healthcare leading to this sense of isolation. Also, there's a significant lack of not just the social, but the financial support for these individuals. Many folks are unable to work, sometimes getting fired from their jobs for that reason, or going on to temporary disability or leave of absence, and then finding that they're unable to return to work to a full degree or even part-time in some individuals. And for some of the worst cases, these folks have to apply for disability income in order to try and regain that ability to support their families. And the unfortunate struggle is that their access to disability has actually been much more difficult than we had hoped. Next slide. So I'm just going to take you through two quick examples of really common situations that I see in my clinic. The first is a woman in her 40s, previously working full-time in healthcare, supporting a family with 3 children, considered herself the life of the party, outgoing, energetic, and healthy with essentially no significant prior medical history. She developed an acute COVID infection and then had long COVID symptoms that were persistent. And after just 6 months of these, found that she was unable to return to work, unable to take care of her 3 children because of the significant physical and cognitive limitations. These also led to significant emotional dysregulation episodes, led to eventually the failing of her marriage, and she did eventually attempt suicide. Next slide, please. We also have a case of a woman in her 30s, working full-time as a business manager, also stepmother of 2 children, considered herself an emotional, even-keeled source of stability for her family, was typically the one that people would go to if they needed help. Also did not have any significant medical history. By now, she's had such severe symptoms of long COVID for over 2 years, including daily panic attacks, emotional outbursts, and severe brain fog, that she was initially unable to work, lost her job. She's been unable to provide for her family, which is now relying solely on her husband's income. And her brain fog is so severe that she has attempted to fill out forms to apply for disability, but is unable to complete them by herself because of the brain fog. And next slide, please.
Thank you, Dr. Anderson. And so I think having a better understanding of now kind of what long COVID is and how it affects everyone, we wanted to take a moment and say, kind of illustrate what we're trying to do here at OHSU to try to help support the community that are suffering with long COVID. And so as you can see by the numbers, there's a lot of demand. And so we've established a consulting service for our PCPs throughout Oregon, where they can reach out to us and have us be able to work with the patients, evaluate them, order the appropriate labs and studies, make recommendations for a plan of care, necessary referrals, and in some cases prescriptions. And a key ingredient to our success and what patients need is actually nursing support. It's nurse navigations to help patients with complex needs navigate a challenging healthcare system. And so we have also created a few separate programs specific for patients with long COVID. One is that ability to get patients to return to their normal activities, getting them back to walking the dog and taking the mail and getting to work and being able to sustain their work requirements. And so we call this a return to activity program. It's not an exercise program. And it really requires the patient understanding their heart rate and their respiratory rates and knowing themselves and when not to go pushing themselves too far. We have a brain fog program that really works with the challenges that patients long COVIDs have, gives them accommodations and tips and tricks and homeworks to try to help them organize their thoughts and their thinking better. Again, similar to what we tried to do with patients with post-concussive syndrome. And of course, we're one of the few programs in the country that actually is able to refer patients to a mental health specialist specifically for long COVID. And that, of course, is a mental health program of one, Dr. Anderson. And so since we started in March of 2021, we've had over 1,000 visits. We've had 890 distinct patients and over 300 some that have been scheduled to be seen. However, the demand is actually increasing. We're seeing greater demand than we saw before. And now if a patient wants to be able to see us in our practices, in our long COVID clinic, it's about a 4-month wait, which we know is just too long for so many of these patients. And so what do we do? How do we act and move forward to help support this community? Dr. Anderson.
Yeah, so I'm just going to introduce the first 2 points. The first of which is, I think developing community awareness would be really helpful in the folks that are struggling with this sense of isolation that I had mentioned before. Just making sure that the community at large is more aware of what long COVID is, the fact that it exists, it is real, and to know how to be sensitive and maybe even helpful to their friends, their neighbors who are struggling with this. And I think that increased media campaigns or public service announcements would probably be very helpful for this in a simple way. Additionally, I think the mental health aspect of this is so significant, and it is a problem that is honestly too big to summarize in questions about how do we make improvements on this. But if we had to boil it down to, I think, the most acute safety concern, that's about mental health crisis and suicide. And I think providing access to the folks that have the hardest time typically accessing mental health in the ways of maybe increasing funding to community mental health programs would be the most helpful means of doing this.
And thank you, Dr. Anderson. And we talked about the real life impact that this has on individuals, including their finances are completely strained. They're unable to work. They risk unemployment and bankruptcy. But kids are out of school. They're not able to attend classes. They're not able to participate in sports and after school programs and clubs. And so people need protected time to recover so that they don't push themselves unhealthily into this post-exertional malaise and all the other bounty of symptoms that they can experience. So they need that financial assistance to be able to recover safely and the social work support to improve that. And of course, our healthcare systems are struggling here too. This was a new condition that there is no board certified long COVID doctor, if you will. And we've had to be able to beg and borrow from all our different teams to try to be able to support the different multidisciplinary practices we have. And so funding is needed for the different programs across the state, these expert programs, multidisciplinary practices, to help keep them going and to provide their care management. And we also need our PCPs to be informed and to have the tools to be successfully manage these patients as best as they can in primary care and know when to refer to specialty practices. As an example of this, we have the kind of the sobering reality that even our pediatric program at OHSU right now is suspended just because of the resource limitations, which means that for our kids out there in Oregon, they don't have a specialist that they can go to right now for long COVID. So again, we wanted to thank the committee and Chair Dexter for their time today, and thank you for giving us the opportunity to talk about a population we care very deeply about.
Thank you so much, both Dr. Herman and Dr. Anderson. I know this seems silly, but can I have each of you, for the record, state your names? I don't think you referred to each other, but never to yourself. I'm sorry.
Okay, that's all right. Well, that's a good error, right? So Dr. Eric Herman.
Thank you.
And I am Dr. Jordan Anderson.
Thank you so much. And also, those were really helpful slides. So if you'll be sure to forward those to our committee staff, Brian Newbert, he'll get them posted so that the public has access to those too. Thank you so much. Committee members, I know that everyone is staying over. I appreciate your commitment to hearing these really experienced and insightful panelists out. Does anyone have a quick question before we close?